Okay, today I'm reacting to this MSNBC article, How a Second-Term Trump Could Destroy Medicare as We Know It. Politics and the news outlets that speak for politicians can just be full of ridiculous information. I just can't imagine what I'm going to get into here. It says that Project 2025 recommends Medicare Advantage be the default option for enrollment. This might be a newsflash, but more than half of the people with Medicare, of their own accord, have already chosen Medicare Advantage. It's at almost 54% now, 53, 54%. They have already made that their default option. So whether or not Medicare makes that the default option to choose a Medicare Advantage plan or stay with the original Medicare, that already is the default. But let's see what it says. It says, that may sound like a minor change, particularly if you're not familiar with Medicare's offerings, but this plan, could it come to fruition, will likely degrade not only Medicare, but healthcare for all Americans, no matter our age. That is so ridiculous. I mean, 53% of people already have Medicare Advantage plan, and it's not degrading the entire system, and nor would it. Medicare Advantage is like your group health insurance plan. Medicare Advantage is like Obamacare, ACA, so that's just ridiculous. I mean, Medicare Advantage was started by Republicans, so Democrats hate it. Obamacare, ACA, Affordable Care Act, so the current health insurance was started by Democrats, so Republicans hate it. But the two are almost the same thing. Obamacare for people under 65 and Medicare Advantage for people over 65 are almost the same thing. So to say they would degrade the system, then if that's true, then ACA also degrades the system. Now it talks about, since his run, he said he promised to save Medicare, Social Security, and stuff, and then he said he would never make any cuts to it, and that was a lie. The truth is, during Trump's presidency, he did not make any cuts to Social Security or to Medicare. Medicare Advantage costs the government billions of dollars more annually than the traditional offering. Yeah, it does cost more, but only slightly more, because we're talking about these massive trillion-dollar budgets, and it's slightly more, like slight percentage. We can actually look at Kaiser Family Foundation and some other outlets that have done the research on this. We're talking 1 or 2% more. But what beneficiaries get for that is much, much more. Giant health insurers game the Medicare system, profiting at the expense of taxpayers and patients alike. The government pays insurers a minimum fee per enrollee based on each enrollee's health, something done to discourage companies from cherry-picking the healthy. But insurance companies do their darndest to make their enrollees appear as sick as possible to the federal government. I'll bet that links to the Wall Street Journal article. Let me guess. Boom! I'm so right. That Wall Street Journal article was unfounded. And actually, there's an article you can read that debunks that from the Association of Health Insurance Plans, AHIP. And it pretty much debunks that whole thing. So giant insurance companies are gaming the system and benefiting at the expense of enrollees. The facts do not sustain that. If you have original Medicare and you go to the hospital, you're going to pay over $1,600 the minute you're admitted. For most Medicare Advantage plans, you will pay from $0 to a few $100s. It's just so much more affordable. Medicare doesn't cover things like dental, vision, hearing. Even your doctor's visits, you got to pay 20% of your doctor's visits. You got to pay 20% of every procedure. I mean, if you have cancer or something like that, your costs will go off the chart. 20% of every single chemotherapy treatment. With Medicare Advantage plans, you pay 20% until you reach a max. That max can be, we've seen maximum out-of-pockets as low as $500 and as high, and that the maximum that they're allowed to charge is in the $7,000 to $10,000. Well, there is no maximum with original Medicare. You could pay hundreds of thousands of dollars. So to say that people are being taken advantage of for Medicare Advantage, I don't know how much more of this I can read because it's outlandish already. Okay, why in 2024 does Medicare Advantage cover more seniors than traditional offering? Trump, to be clear, is far from the only reason. So trying to paint this Medicare Advantage as a bad, like, Trump thing, which is ridiculous. Okay, traditional Medicare can seem complicated, and most experts recommend its users also purchase the Medigap insurance. Okay, now they're getting a little bit into it, but the reality is most people can't afford to get other coverage with Medicare. If you can get a Medicare Advantage plan at zero premium and you're not paying more for it, but it's going to cost you hundreds of dollars a month to have a Medicare supplement, which is thousands of dollars a year. It's kind of crazy to me that this outlet that's almost always arguing that the person without money is being squashed is arguing that the person without money or the person living on a fixed income should spend hundreds of dollars a month on a Medicare supplement. The only reason you do that is to try to paint an ugly picture. So I'm kind of done with this article. It's basically just a lot of politics. And I don't buy into politics no matter which source they come from, whether it's on the Democrat side, as this is, or on the Republican side, there's just so much spinning of the truth from political outlets that it's ridiculous. So let me just tell you what my thought is. Regardless of whether we have Democrats or Republicans in the White House, they both support the Medicare system, but they support it in different ways. Democrats, because they voted against Medicare Advantage, they don't really like it. And there have been quite a few of them that have kind of attacked it. Actually, just this year, we've had the biggest cuts to Medicare Advantage that we've ever seen. And we're going to see in 2025 that Medicare Advantage might not be as pretty as it was in 2024. But by the same token, Democrats don't want to make changes to any of the ages that someone can be eligible for Medicare. Where on the Republican side, they're very supportive of Medicare Advantage, and it has been a very successful program, but they look for other ways to cut the costs on Medicare, like they've talked about raising the age. I mean, no one really likes that, because if you're 50 right now, you don't want to hear, oh, you're going to have to wait 20 years to get Medicare instead of 15 because they're going to raise the age. So that's really unpopular. And honestly, most Republicans don't say that, only a few. But anything that can be grabbed a hold of for a political purpose, they're going to do that. Okay, so that's it for my reaction to this article. I think it's inflated. It's being used to influence people in their voting. I say vote for who you think is best for the country, and know that your Medicare is going to be safe either way.